Orem's self-care deficit theory versus Roy adaptation model in nursing. The first theory focuses on the self-care needs of an individual. Dorothea Orem's self-care deficit theory defines self-care as actions intentionally performed by individuals to maintain their own life, health, and well-being. According to Hartweg and Metcalfe's interpretation, self-care aims to satisfy an individual's corresponding needs. The self-care deficit essentially identifies one's requirement to maintain health. When self-care is not upheld, deficit, and illness may commence. Consequently, Orem's model emphasizes these self-care needs as something a nurse can fulfill to promote health and well-being. Overall, the underlying message of the self-care deficit theory is that a person can take responsibility for their health and the health of others. In contrast, the second model emphasizes a more flexible mode of existence. In the Roy adaptation model, humans are viewed as complete adaptive systems coping with environmental changes to maintain and facilitate individual and environmental adaptation. Throughout their lifetime, individuals constantly interact with stimuli from both internal and external environments that either enhance or diminish their ability to cope. Hence, they develop coping mechanisms for external or internal environmental changes. Adaptation is supposed to lead people to the best possible health, well-being, and quality of life in this framework. Overall, Roy's model focuses on improving the basic life processes of individuals and groups. In conclusion, the two models approach the self-standing and independence of a patient's contribution to their well-being, even though both promote better patient care. Roy's model focuses on a person's involuntary adaptation, which occurs when they respond positively to changes in the environment. In contrast, Orem's theory focuses on viewing a person's intentional self-care abilities to maintain life, wellness, and illness. Overall, while the adaptation framework focuses on a person's adaptation, the self-care deficit theory emphasizes self-care.